Hey everybody, welcome to my office and welcome to my YouTube channel. My name is Sarah Peternell. Today I'm answering the question about what is low dose naltrexone and how may it help my Hashimoto's disease. I'm the creator of a 30-day online program called Nourished and Renewed with Hashimoto's. That's a great place to learn more about some of the holistic and lifestyle and diet measures that you can take to live your best life with Hashimoto's. I also work one-on-one with clients, and I'm also, in addition to being a holistic nutrition Hashimoto's expert, I'm also a patient advocate, which means that I work very closely with the clients that I see here in my office to help them have the right kind of conversations with their doctors to ensure they're getting the best, most optimal testing, that they're tracking their symptoms as it pertains to maybe seasonality and the type of medication that they're taking, and also that they're sharing with their doctor what they're doing holistically, whether it's through diet or through supplements, so that their doctor knows that they're really a partner or they're the best manager of their own health with Hashimoto's. So, I talk a lot about medications. I do not diagnose, treat, cure, or prescribe medications in my holistic nutrition practice, but I do help to explain potential therapies and potential medications that may work for some people depending on their circumstances. Mainly, what I want people who have Hashimoto's to know is that there are a lot of different options for treatment. When I was diagnosed nearly 20 years ago, I was given a generic levothyroxine and said, "See you in a year, we'll retest your levels, good luck and goodbye." And that did not work for me. So I've spent literally my entire nutrition career and personally working on myself as a guinea pig because I have Hashimoto's, trying to find out as much information, doing as much research as I can, and putting together what I would consider to be sort of all of the best tips and information to help people like you, if you're watching this video and you have Hashimoto's, have all of these resources at your fingertips as well. In fact, that's why I created the Nourished and Renewed 30-day online program, because there is just so much information that we need to understand and disseminate and apply to our own lives to feel our very best. So today the question is, what is low dose naltrexone? Why is it used for Hashimoto's and how can it help? So this is actually a really interesting area of medication treatment. And from my experience, most holistically minded doctors, meaning your MDs, your endocrinologists, even your DOs, your integrative docs, and prescribing naturopathic doctors, these kinds of doctors are really thinking about ways in which to help modulate the immune system. Remember, I talk all the time about the wonky immune system and the ways in which that component, right, that kind of root cause of the Hashimoto's and the hypothyroidism, we need to address that first and foremost. Low dose naltrexone, we'll just call it LDN, works to help modulate the immune system, and doctors are starting to understand that where levothyroxine or thyroid replacement hormone medication alone may not be good enough for resolving some of these pesky symptoms that do not go away over months or years, even after standard medication treatment. So sometimes a low dose naltrexone needs to be compounded. It is not necessarily a medication that your doctor can just prescribe for you to pick up at your local CVS or Walgreens. So the first thing is that you'll need to know if your doctor, who's open and willing to prescribe this type of medication and understands the benefits, also has access to a compounding pharmacy. I take low dose naltrexone, LDN, and I get it from a compounding pharmacy here in the Denver metro area. I'm very thankful not only to my doctor who prescribes it, but also to the pharmacy who compounds it, because I've been able to do a lot of my research and learning and have a true understanding of this medication through my conversations with the pharmacist, and they have been very helpful in explaining to me how this medication works. So I've taken some notes. I wanted to share these with you today, and I wanted to explain how this medication might work for you. So first of all, it's used usually in conjunction with levothyroxine or Synthroid or Tirosint or potentially one of the natural desiccated thyroid medications that I've done some other videos on, like Armor and Nature Throid, etc. It's not typically used alone because it needs to work in conjunction with the proper amount of thyroid hormone in order to get that active thyroid hormone into the receptor sites of your cells. It provides really a synergistic relief system for especially the Hashimoto's patients that have pain syndromes. Okay, so this is one of the most important diagnostic criteria, I think, for your doctor to recognize, which is that if you have traveling aches and pains, if you have like chronic fatigue-like symptoms, or if you have fibromyalgia-like pains, this is one of the areas in which most research has been done to show that low-dose naltrexone or LDN can be used to help patients regain more quality of life. So LDN, it has anti-inflammatory properties which negate some of the issues that are related to the autoimmunity, like stress, other maybe blood sugar regulatory issues, including a diagnosis of diabetes, toxicity exposure, obesity and weight gain, etc., body composition issues. And it helps to increase the endorphin function of your body. So endorphins, you know how powerful those are after you exercise. Maybe you hop off the treadmill and you're like, woo, I feel great, right? So it's that endorphin rush that we get that really helps to boost our health, boost our mood, and also helps to relieve pain. So it is thought that by decreasing these inflammatory markers, basically cytokines, interleukin activity, and lowering certain IFN alpha and TGF alpha markers, that LDN improves thyroid function, not just in the thyroid, but also in the pituitary, having the pituitary gland tell the thyroid better what to do. And it may also help to modulate thyroid receptor sites on each of your trillions of cells in your body. So this is even better news, right? Because a lot of the problem with some of the medication is that the thyroid hormone is not being taken up into the cell and has almost like a thyroid hormone resistance problem in the body. And so this problem can be compounded by inflammatory processes, systemic inflammation, and a host of other concerns that often come along with autoimmunity. So the LDN works by basically blocking and stopping those inflammatory patterns. So it works with both the pituitary, it works with the periphery cells, and it has many physiological actions that also help to improve T4 conversion into the active T3. So there are cells in your body. I'm not going to go into too much of the biochemistry, but there are cells in your body that are more than happy right now to play along with and produce more of that autoimmune process that's taking place in your body. They've gone rogue. They're the wonky immune system cells. And sometimes they just need like a block or a medication to come in and tell them to stop what they're doing, right? Kind of like the mom to her kids who are misbehaving. Hey, figure it out, right? Or you're going into timeout. So that's kind of the way I like to think of LDN, is that it's basically a referee that's coming in and it's re-regulating the cells that have gone wonky during the autoimmune process. I'm not going to go too much into dose, but basically what you need to know is that low-dose naltrexone is just that. It is a low dose, sometimes as low as like 0.1 and a 0.1 of a milligram, and typically is dosed only up to about 4.5 milligrams. Finding the right dose for you is 100% between you and your prescribing physician, but I want you to know that the difference you may have heard is that some people use naltrexone in the higher doses to help with opioid or alcohol addiction. And that is a very different use and not what we're talking about here today for support of the inflammatory cells and helping to reverse some of that autoimmune process in these cells in the body. Two totally different things. So speaking with your doctor about dosages is really important. But it is interesting to note that through some research, LDN has had the following positive beneficial effects on thyroid and reduction of symptoms. 48% of people in this particular study have been able to lower their thyroid antibodies. 61% saw improvements in mood and mental stability, which is great, right? We know just how terrible you can feel, how cranky it can make you, and the corresponding relationship between depression and hypothyroidism, it is real. Also, 66% in this study found that they had more energy, and 40% saw a reduction in pain. So that's kind of how I started this conversation, is that if you have some of the pain syndromes that are related, you may want to consider asking your doctor about this. Sorry, I've been talking all day and I need my water. Okay, so it is often considered that the LDN approach to hypothyroidism and Hashimoto's does not work in a vacuum. Okay, so yes, it is best when taken with the right prescription medication for your thyroid. It has maximum potential when it's really part of a holistic approach to Hashimoto. So just adding this in, if there aren't some other measures already in place, may not be the drug that you're looking for. We know from this, from research and from clinical studies, that patients who have hypothyroidism do best with their medication, levothyroxine perhaps, and or the LDN, when it's part of proper diet, exercise, stress management, and decreasing other health risks, including smoking, alcohol consumption, etc. And also individuals who are working holistically to employ other measures for balancing the immune system, healing leaky gut, and avoiding the foods that maybe cause some of these issues. So we're really talking about food intolerances. We're also talking about holistically balancing the microbiome through the right types of foods and use of maybe even probiotics to help support the immune system. So all of these things go together. If you walk into your doctor's office and you're like, hi, I'd like to try LDN, but no, I don't want to change my diet. No, I'm probably not going to exercise. And nope, I like stress. Your doctor may say, you know what, this might not be the right drug for you. So if you're already doing a lot of things and you have that totally holistic picture and you're still not getting relief, now it's time to try something like LDN. My compounding pharmacist said that she also believes that certain supplements really help to increase the rate of efficacy or effectiveness of LDN in patients who are also taking vitamin D and probiotics. So I talk a lot about these things in my nutrition practice when working with my clients, and you've heard me talk about these things on my YouTube channel as well. So having these proper supplements in place can also help to make something like LDN more effective for you. So again, your healthcare practitioner may recommend, if you're not already taking, a minimum of 2,000 IUs of vitamin D3 once per day. And also taking a probiotic, something like Saccharomyces boulardii, or SAC-B, we call it for short, which can help regulate some of the immune system bacteria in the gut that is responsible for getting things back on track. Okay, so wow, that's really everything I had to share with you today. I wanted to explain that there is this other complementary medication, that you have to have a really holistically minded doc who gets it, that this is a medication that may work for you, and they also have to have access to a great compounding pharmacy, meaning that these pharmacists are also holistically minded. They are well versed in all of the kind of nutritional implications, lifestyle factors that help these types of medications work better for patients. And you should probably work with someone like me who's board certified in holistic nutrition, or you can check out my 30-day Nourished and Renewed program to get more in-depth information about making the right types of diet and lifestyle changes that are going to help you feel your very, very best. Take it from me. I have Hashimoto's. I've been working with Hashimoto's clients in my practice for nearly 20 years. And I am here to help pass on this information to you because you deserve it. You need to know about these things and you can live your best life as well. So thanks so much for tuning in. Please remember to subscribe, like, and share these videos, and I'll be back with more because I'm doing 2 a week and I can't wait to tell you what's next. I'll be back soon. Take care.